Well, in 2003, Thomas was born, and he was diagnosed with a chronic illness, severe hemophilia.
We've always gotten excellent health care. Our health care, the medical treatment that we and Thomas have gotten has never been the problem. That's not the issue.
So this is a lot of the mail we get. This is a few weeks worth. These are bills for stuff that insurance didn't cover. The hospital sends us a few of the same kinds of notices. The lab, the pharmacy, and most of the rest of it is all insurance company paperwork.
I think the first surprise that came for us in terms of insurance was when Thomas was born, he was diagnosed in the hospital after his circumcision. They took him to the neonatal intensive care unit.
And within a couple of weeks of getting home from the hospital from a normal delivery and time there, we get a bill for $50,000.
We had Thomas in an in-network hospital by an in-network provider. We had checked everything. We knew we were covered. Come to find out, the NICU was privately contracted out and not an in-network provider in the hospital, in the very same building, not 50 yards down from the very room that I delivered him.
That was a big shock to us. That was just the beginning. We had what started out as a great plan, but every year they would push us into a high deductible plan. They would push the deductible up. They would push the out-of-pocket up. The premium would skyrocket. In the end, we had a $12,000 plan with a $10,000 out-of-pocket every year and $1 million cap that they put on just because basically Thomas was not profitable for them anymore. You know, I knew why we had the cap. It was because of him, and I felt that they had put a price tag on my son's head.
When we found out we had a lifetime cap, I sat in the car and cried because I knew we were going to hit it and I didn't know how we were going to survive and how we were going to pay for all of this.
This dose of medication is somewhere around just a little over $1,000 a dose. And this is what he gets once a day, basically. Actually giving an infusion, poking a needle in his arm, even when he's screaming, even when it hurts, that's the easy part. It was tough. For a couple of years, we were paying close to $25,000 a year just for insurance and out-of-pocket and everything else. Until finally he capped out the plan. Basically they said, see ya. And by the way, here's an $80,000 bill for a claim we're not going to pay. So not only did he lose his insurance, in the same day he got an $80,000 bill from it.
We started exploring all the different options on how are we going to, what is the next step? What is our next insurance plan?
Social workers recommended that we get a divorce. They said as long as my wife wasn't working, the kids could qualify for Medicaid.
That was absolutely absurd, and it's not in our family values. Getting a divorce is not something that we want to teach our children that that's the way to get health care, to get a divorce. No, the system needs to work for us, not us working the system.
I'm constantly haunted by what's going to happen when there's no more coverage. What's going to happen if I have no more job that provides the insurance? What's going to happen when he hits the next cap and can't access the medication? We're always fighting with insurance companies, with providers that didn't get paid by the insurer like they were supposed to, and it eats up so many hours a week. It's just unbelievable. The illness, honestly, piece of cake compared to all that.